Hi, I'm Dr. Max Gomez, and this is CONCACAF's Winner's Health, your football source for keeping players healthy and in the game. Groin injuries may not be an everyday topic of conversation, but when it comes to football, we need to talk about them. Pulled groin muscles or groin strains are one of the most chronically recurring injuries in football. Players get them, think they're healed, return to play too early, and get re-injured. This cycle of pain and re-injury can be devastating to a player, but it doesn't have to be that way. The groin muscles are a group of 5 muscles located on each inner thigh. They act as a muscular bridge between our thighs and pelvis to move our hips. Their main purpose is to move the thighs toward the center line of the body. It's a process called adduction. Basically, they make it possible for us to pull our legs together. We also use them when we kick a football with the inside of our foot, or change direction where we need them to help control and limit the movement of our hips. We even need them to stabilize our bodies when we run and land.
A pulled groin muscle happens like most muscle strains, when a sudden, often unexpected force is applied to the muscle, pushing it beyond its elastic capacity. The muscle is overstretched, like a rubber band being pulled taut. This results in pain, inflammation, and irritation at the injury site. In some serious cases, the muscle could actually be torn and damaged.
Most football players are aware of how much they use their quads and calf muscles. As a consequence, they focus on them in their regular workouts. That's not true with groin muscles. They're often ignored. That's a problem because the groin muscles are used all the time in football. And when they're not kept stretched and strong, they're much more susceptible to injury. From getting tackled, reaching out to the side for a ball, quickly changing directions, or when sprinting with the foot turned outward. Eventually, this level of stress can cause the muscles of the groin to tear.
A player would know that they pulled their groin muscle. They may feel a tear or a sharp pull or a sharp pain at the time of the injury. Afterwards, there may be some limitation in their range of motion. They may notice some weakness or pain with movement, even some swelling and discoloration or bruising if a significant injury has occurred.
But pain in the groin doesn't always mean you've pulled a groin muscle. There are a number of other conditions that pain in this area might be signaling, like a broken bone or a problem in the hip joint, or you could have a groin strain coupled with some other condition. It's not uncommon. So if you're experiencing groin pain, it's important to see a doctor as soon as you can. Only a doctor will be able to properly assess your problem and tell you if you may need surgery. Sometimes you will. Because players don't usually strain their groins right outside a doctor's office, someone on the team, a coach or a trainer, should know how to administer immediate first aid. First aid for a groin strain is essentially the same as it would be for any strained muscle. It's the old familiar RICE regimen, which stands for rest, to prevent the strain from getting any worse, ice, to control any inflammation and bleeding, compression, to manage the swelling and help stabilize the area when you move, and elevation, so gravity can help remove blood and inflammation from the area. These first aid actions are extremely important and should continue for at least 48 hours. They provide the first critical baseline for recovery. However, they aren't in most cases sufficient for recovery. Rest, ice, and even painkillers will help with pain or control swelling. But the reason they're only first aid is that they can't actually repair the damaged muscle. They can't bring it back to playing form. For that, you need both time for the muscle to heal and exercise to rehabilitate it. To understand why rest alone won't do it, you first need to understand how a muscle heals. When a muscle is damaged, for example by a tear, the body naturally reacts by trying to repair the wound. New tissue is created to form a patch. Some will turn into muscle fiber, but most will become scar tissue, dense, stiff, and inelastic, and that's the source of the problem. Scar tissue isn't as strong or stretchable as muscle tissue. So what you have is a muscle with a patch job. That can't stand up to stress the way it needs to play football.
If a player returns too early to sport, they may have some weakness or imbalances that either make them at risk of injuring that particular area more significantly, or another injury, say in that other hip, or in that same hip in a different location.
Deep massage is one way to loosen up the dense, stiff fibers of the scar, but in the end, you need movement and exercise to break up the scar tissue, re-educate the damaged muscle, and improve its elasticity. This is where a physical therapist comes in, who can design a specific program for you. A program that involves stretching, that starts with slow movement to give the new tissues time to adapt. Strengthening, that gradually reconditions a muscle to respond to new workloads. Balance and coordination, to retrain your nerves to react quickly and accurately to whatever comes their way. When your medical team gives the okay, it's time to return to the field, the training field, where you can gradually return to football-specific workouts and drills, making sure you focus on both strength and flexibility, and include exercises which involve quick changes in direction and contact with other players. When all the movements associated with football can be performed at game-playing level without any pain, then and only then should you return to actual competition. Competition, while bringing out the best in us, also tempts us to make bad choices that can result in re-injury. Your body needs to be totally ready to handle competitive play. Readiness begins with your pregame warm-up, and this time, don't neglect your groin muscles. Stretch them, warm them up, get them used to the field they have to respond to. You'll go a long way in preventing groin injury and re-injury. Thanks for joining us for CONCACAF's Winner's Health. Take care and stay healthy. For more information about groin strains, please visit CONCACAF.com.